So as I mentioned, I will be placing everyone on mute. So thank you again for joining our Dentrix Treatment Planner module training. Some of the items that we're going to cover on today's presentation is some security access as it pertains to this module. We'll take a look at how to navigate the window itself, the treatment planner window itself, and how to interpret the views that you have. The treatment planner itself also has a toolbar, so we'll talk about some of the items that you have access to from there. How to actually add treatment plans, we'll just do some brief review of that from the patient's chart. Now the bulk of the treatment planner itself, you know, the meat and potatoes would really be the plan case setup. So we're going to talk about how to create new cases, how to assign case statuses, and put some sensitivity to these cases as well. And you'll see in just a second what that means. We'll talk about the supporting information tab as we navigate through that module. There's also a case status history tab. I will show you how to complete your treatment plans from the treatment planner itself, and that would be case completion. And as far as the treatment planner, there's different views. I'll show you how to toggle and change your views within the module. We'll talk about also the treatment plan printouts, where you'll have the option to perhaps print a consent form from that module, and the treatment plan reports that are accessible via the reporting module. So I won't actually be doing a presentation. I'm going to be on the live environment actually. So there is a few items I wanted to mention first, and that goes as far as security. In order to access the treatment planner itself or perform some of the functions inside of the treatment planner, you need to have access to it. So for the most part, if you are a dental assistant, a hygienist, most definitely a provider, from the get-go, your security access already allows you to gain access to the treatment planner, but we just want to make sure that the security access is in place. So for those that are on the call that may not necessarily have access to setup, you will not have access to some of these files I'm about to go through. However, just to make you aware of it as far as security goes, I'm going to go ahead and access real quick the security setup here for Dentrix, and that is under your Office Manager window, which is kind of like home page for Dentrix. Underneath the Maintenance drop-down menu, there is Practice Setup, Security Setup, and then you have your Security Rights Setup. If I can just briefly go through the features, again, not spending too much time on setting up users and security access, but just to go briefly through some of the features that are related to the treatment planner. So as you can see, treatment plans itself is a check mark. So if the user is going to need access to the module, we need to make sure they have access to treatment plans. The treatment planner, rather, at the bottom. If it's a user that's going to be actually marking in the patient's chart treatment plans, then they're going to need access to treatment plans. And what can they do? Can they edit treatment plans? Can they enter? Deleting is always one of those options that we do refrain from utilizing unless you are a super user or more of an admin role. But the golden rule for deleting is that no end user really should have access to deleting. You know, once something's deleted, there's no trace of it. So use your delete options wisely on who gains access to that. Is that user going to be able to assign approval statuses on these cases? Are they able to print treatment plans, or do they have access to the treatment plan setup? So be mindful of the treatment plan aspect of it from the patient's chart and the treatment planner module itself. All those are security-based here in Dentrix. Now, accessing the treatment planner itself, there's more than one way of doing the same thing in Dentrix. So that's really your chair icon. So wherever you see the chair icon in Dentrix, that's where you'll be able to access the treatment planner module. So it's very commonly used from within the patient's chart. So you're in the patient's chart, charting your conditions, your completed work, in addition to your treatment plans. So to access the treatment planner module itself, it will be your little chair icon. In this case, just to give you some definitions of color here, if the chair is green, that means that's just a visual cue for you that there's treatment plans charted for this patient. If the chair has no color, it's gray. If the chair is not colored green, rather, then that means the patient does not have any treatment plans charted. Now, charting your treatment plans, again, just to go briefly over that, to show you here from the patient chart module, obviously you're going to indicate what is being treatment planned. Does it apply, is it a procedure or service that applies to the entire mouth, or is it actually tooth specific? So you're going to determine what needs to be treatment planned. So we are treatment planning something on tooth 7, as you may be familiar with. You're going to select tooth 7. If the same procedure that you are treatment planning and the same surfaces, if it's surface related, applies to multiple teeth, then you're going to multi-select more than one tooth here. That way you're able to treatment plan the same procedure in all teeth that you've indicated. So if I select tooth 7, I'm going to go ahead and say I'm charting an amalgam here. I'm going to select my surfaces, and then this is your key right here, TX. Pressing that status code is what indicates that what you just chose to chart is actually a treatment plan versus an existing work or versus a completed work. So I'm going to go ahead and press TX. And in this case, it's shading in red. Perhaps some of these, perhaps the industry colors are already set for you, but ultimately the organization has the capability of changing the treatment plan colors if that's what you wish for. So just a quick recap there. Again, we selected the tooth, selected what we are charting, select the surface in this case because it is a surface related code, and then we're going to press TX, and there's your chart. It's shaded in the visual aspect of it, and it's also appeared at the bottom in what we candidly reference to as the patient ledger. So going back briefly to the colors, the system does default with the industry standards for completed and treatment plan. However, your organization has the ability to change the colors need be. So just briefly to show you where you can find that. Again, you do have to have access to setup in order to do that. And also I want to remind you that any changes as an end user that you make in Dentrix, for the most part, only affects you. So if this is a global change within your organization, then you need to work with our support team here at Health Choice Network so we can make it a global change. It's actually called the registry key, so we will apply those changes to based on what was done in your while you were setting it up, and we will apply it to the registry key so it can be global for your entire organization. So the treatment plan colors are actually inside the patient's chart, and it's located under the File menu. Down here under Chart Colors, Set Chart Colors. And there's your paint colors for treatment plan. So again, as a reminder, the Dentrix, right off the box, comes with the industry standards, but the organization can change it, need be. And this is how we would do so. So if that's something you want to change, please work with HCN support to make it a global change for all your users. Again, that was under File, Set Chart Colors. The chair icon, having the chair icon on your toolbar is pretty standard also. But if you have found the need to actually add it to your toolbar because it was not there, again, it might just stick for you as the one who made that change to the toolbar, but it may not necessarily be a global change. So if for some reason you have had to add that icon to your toolbar, again, work with the HCN support team so we can make it a global change, and it can apply to every other user as well, and it potentially sticks. That way you won't find yourself having to add it back in the future. So obviously, in order to utilize the treatment planner module itself, obviously we have to have treatment plans procedures first. So now that we have treatment plans, again, our patient chart visual teeth view does show us those colors. And at the bottom, we have our ledger. I'm going to go ahead here on the far right and uncheck what I do not want to see in my patient's chart, and I'm only going to leave treatment plan. So what the system does now is modifies your patient chart to only show the treatment plan and the ledger below. So everything else is hiding because I've chosen to only view the treatment plans. So as you can see, the system charts the actual date of service of the treatment plan, the tooth number, the surfaces, the procedure that was treatment planned, the provider. The provider will be the provider that the patient is associated with in the family file. So be very mindful. If there's different providers that see this patient, aside from the one that's defaulted in the family file, then it's very important to always do file change provider before you start charting those treatment plans. Or else that line item will be under the incorrect provider. It gives you that description of that procedure. The status TP means treatment plan. And then if your organization does maintain any prices, any fee schedules in Dentrix, then perhaps you will have a dollar amount associated as well. So now that we've gone through some basic charting of treatment plans and how to actually interpret it from the patient chart module itself, let's go ahead and now actually launch the treatment plan module. And again, that would be by clicking on your little chair icon. At least that's the quickest way to get there. Now when the treatment plan opens up, this is what you're initially going to see. So let's talk a little bit about the navigation first before we actually get into the usage of this module. And I do want to say that this is actually one of these underutilized modules in Dentrix. A common phrase that we hear from our providers is that there's just no time to utilize this module to its full capacity. We can organize in this module your treatment plans in various different ways. And obviously that takes time. So if you're with the patient in the chair now and you're just trying to get to that next patient that's scheduled, coming in here and organizing your treatment plans, it can be extra steps. So it is an underutilized module by many of our centers. For the most part, a lot of the centers just come in here and perhaps just print it out, but actually do not use the features that they have access to. So let's go ahead and take a look. So let's take a look a little bit about what we're reviewing here. So there's various toolbars located in the module. So the first toolbar that we have here is, as you can see, a toolbar that's very common. It's really a toolbar that travels with you across the entire Dentrix system, whether you're in the family file or you are in the patient's chart. These icons here travel with you wherever you go. So from within the treatment planner, I can jump into the patient's chart. From within the treatment planner, I can access the family file as well. I can jump into the appointment book. I can go into the office manager. To the far right, at least those are the more common icons that we will access here. To the far right, I can select a patient. So even though right now I'm actually on a patient, I can access another patient's treatment plan right from here if I wanted to. I can also access the medical alerts. So if you wanted to just quickly bring up these patients' medical alerts, their allergies, their medication list, if you just wanted to briefly bring that up without having to go back to the patient's chart, without having to go back to the family file, you can do that. And it's not just for viewing purposes. I can actually add from here if I wanted to. You also have access to the patient alerts. So perhaps you want to see if there's any pertinent or immediate alerts that are assigned to this patient. You can click on your patient alert icon. And just real quick, my icons, my patient alert icon and my medical alert icons are shaded in white and gray, which means there's nothing there. If it's a red cross, if it's a yellow flag, then that's an indicator, a visual indicator for you automatically that there is information in those two files. And then you also have access to the More Information window. And in our last version here for Dentrix, the most recent within the last month or so, they had major upgrades to that More Information button. It's really more robust. It's a way to actually see a lot of what we've just covered in one window. So I'm going to go ahead and click on that just to remind you what the More Information button is. So from here, I can view that demographic information, which was my family file icon. From here, I can see procedures, which is my patient chart icon, essentially. I can view medical alerts. I can see vitals information, all from one window. So these icons in the treatment planner allow you to branch out to other areas in Dentrix and see more information just while being in here without having to navigate out of here. The third toolbar is rarely used, and it's more so because we don't do billing out of Dentrix. We do billing out of our practice management system. So a lot of the icons, or most of the icons, I should say, that are on that third toolbar is really more so for insurance billing, sending up claims information and whatnot. So I do want to show you the ones you can use. For example, the refresh. And refreshing is something that can or is commonly done in Dentrix. You can refresh from the patient's chart, and you can refresh from the treatment planner module as well. So if you have just recently charted treatment plans in the patient chart and you jump to the treatment planner and perhaps you don't see it yet, you can click on the double green arrow, which is your refresh, and that will refresh your screen, and it'll pick up the new procedures that you treatment planned. Or perhaps you have created a consent form here. Or perhaps you did some setup here in the treatment planner, which we'll be talking about in just a little bit. Perhaps you created a new consent. Perhaps you created a new case note template, and it's still not showing. Just refresh, and it picks up those changes or those new additions that you just did. And you can also find your refresh underneath your file drop-down menu, if that's what you prefer. And a very common option as well is F5 on your keyboard. So the treatment planner itself, it is broken up into 3 areas. And what you're seeing is the default view, essentially. In just a second, I will be showing you how to change the view if you prefer. So the first thing you see here is the treatment plan case setup. And I know I'm in that section here on the left because it clearly says that here on the title bar. And the button at the bottom is in orange. So once the bottom buttons are in orange, that's an indicator for you that that's where you are currently in Dentrix. If I jump over to supporting information, for example, I will get to see the supporting information up here instead. So that's how you navigate there. To the right, that area is split into 2. So to the right, I see, which is the visit information or the treatment plan itself, kind of like the ledger view. And then at the bottom, you have the patient chart itself. And all these areas can be increased or decreased depending on perhaps your monitor size or what you want to see. As I mentioned, you could change your view. If you want to change your view, that will be this icon right here. It says Treatment Planner View. If you're more of a menu drop-down user, if you will, there's also a view drop-down here also, where you can change your treatment planner views. So the one that we're looking at right now, which I mentioned was kind of like the default, is the view case detail with progress notes. So what I candidly refer to as the ledger is your progress notes. It's the actual terminology here in Dentrix. So this area right here is your progress notes. I can come here to view and change it. Perhaps I'm educating the patient. Perhaps I'm just reviewing with the patient and I just want the patient chart. I can quickly jump into patient chart only and only show that piece and hide the progress notes. I can do the opposite. I can hide the patient's chart and only have the progress note itself. And this is interactive, which we'll talk about that in just a little bit. I can click in here and set complete. We'll talk about that in just a little bit. I can edit from here, whatnot. So there's different views that you can change to, depending on what you prefer. So let's just go back to the system's default. Sometimes as well, if you have just recently charted in the patient's chart, perhaps you just recently charted some existing extractions or missing teeth, and your treatment planner hasn't refreshed yet, again, utilize your refresh button, and it would update this view as well. So let's talk about the treatment plan case setup. So we're going to talk about some of the navigation or the usage that you have access to here. So the best thing about the treatment planner, again, is the organization part of it. I can organize the patient's treatment plans in various case folders. And some of the examples I'll show you today just to give you an idea of how we can use it. I can have a folder perhaps for items that I'm going to refer out. I can create a folder for items that perhaps are urgent, or maybe there's different phases of visits for this patient. I can set different folders based on number of visits, based on a phase or urgency. So those are just different ideas that you can create different cases. So those are one of the examples I'm going to show you how to do today. Perhaps the hygienist can have her own folder. So I can also modify my cases based on the staff. Perhaps the procedures that are hygienist related, and perhaps a folder for the dentist himself. So let's work a little bit within the treatment plan case setup. As you can see, it has its own toolbar. And which we'll briefly just go over in just a second. Right underneath that is a folder. The moment you start treatment planning for that patient, the system will automatically create this folder for you. I will be showing you how to create a new case folder in the event that you did want to organize and group together. But off the bat, the system creates a folder called Treatment Plan, and it tells you the date that it was created on. So these are all the procedures that this test patient has currently treatment planned. So let's go through the icons. The first icon that you see is the folder icon with the little sunburst, and then it says New Case. So I already have a case. It's called Treatment Plan. That's the general one. But perhaps I want to create a new folder. I want to create a folder for those that I am referring out. So let's go ahead and do that. I'm going to go ahead and click on my New Case folder icon. And I'm going to go ahead and name this. As you can see, I now have the capability of naming this. I'm simply going to type referrals. Again, you can word it however you prefer, depending on what the need of that folder is for. So now I have two case folders, the default and the one I just created. If you wanted to create a third folder, then you just continue to click on the New Case folder icon there. The other icon next to that is the Delete Case folder. So if I have just created this referrals folder and I kind of changed my mind and I no longer need it and we haven't done anything with it, because the moment you start having activities with that folder, for example, if the patient approved it and you said that the patient has approved that folder or that case, once you start having activities associated to the case, then you can no longer delete it. But the system does allow me to delete this one here because it is a blank one thus far. I can link cases. So if I have created this case here for referrals, but yet I want to link it to another folder that I have created that perhaps it's associated in some way, I can link two case folders by using that Link Alternate Cases icon. Update case status. We're actually going to be using that in just a little bit here. You are able to assign current statuses to these folders. You're also able to assign severities to the folders, and that's your stoplight icon. We're able to generate consent forms. We'll take a look at that in just a second. And then you have your up and down arrow, which just allows you to rearrange. So if you rather have your referrals folder at the bottom, you just click down and it brings it to the bottom. That's all that does. You have your printer icon, which we'll be taking a little bit look later towards the end of our presentation, how you can actually print your treatment plans report or sheet for this patient. And then you just have your expand and your collapse icon, and that just either shrinks your folders or expand them. So that's just a little quick overview of the icons themselves. As we go through the training, we will be utilizing these icons, and you'll see how they actually work. There is a minimum setup in Dentrix, and I will be showing you that as we go through the training as well. And most of that setup is done in the settings button at the bottom left. Here in the settings button, you are able to create a case notes template. And I will refer back to this setup once we actually get to that portion of the training. So case note templates, these are notes that you can associate to my referral folder or to my case folder. These are in no way associated to your actual clinical note, and it doesn't copy to your clinical note either. These are just notes that you can associate to the treatment planner case. From here, you can also create consent forms. The system does come with some defaults: consent for anesthesia, treatment, or declining of the consent as well. You are able to create your own or edit the verbiage that is there. So once we get to that piece of the training, then we'll refer back to how to actually create those. All right, so let's go ahead and take a look at how to actually now utilize my referrals folder. So this is that piece of the module that I was mentioning to you that is underutilized. It's actually being able to utilize these additional features that the planner has that allows you to organize your treatment plans. So now that I have created this new case folder, what I want to do is organize the patient treatment plans. So the patient has 6 procedures that we need to that has been treatment planned, and I want to organize into the appropriate folder. So for this example, I'm going to say that the patient's retainer needs to be put into the referral folder. I want to separate them. So what you're going to do is basically click and drag. So this is what you're going to do. You're going to click on the procedure. As you can see, once you hover over it, it turns blue. So what you're going to do is you're going to hover over the procedure and click on it. And without actually releasing the click, you're going to drag it to the folder that it applies to, which in this case is the referrals folder. So you're going to click, drag, and drop, essentially. I'm going to do the same for the Pontic here. Click and drag. And I'm going to do the same for tooth 20. As you can see, it's showing me the exact details that we see in the patient's chart. I get to see the procedure, the description, and the tooth number. If there are any surfaces, I would be able to see the surface as well. So just click and drag to the folder that it applies to. So I've done my first step of organization here. I started with one folder, 6 procedures. I created a second folder and I named it referrals. And I clicked and dragged those 3 procedures that, for example, at least for training purposes here, we're going to refer out. So now that's just really step 1 here of the organization. There's just so much more that I can do with these case folders now. I can go as far as assigning case severities. I can go as far as assigning case statuses. And I can also go as far as assigning visits. So let's say you are now working with the patient. You're educating the patient on what you feel their treatment plans should be. So at this point, perhaps you're working with the patient on what needs to be done next. Perhaps the patient's treatment plan is going to be done within 3 visits. I can come in here and associate a visit to each procedure. That way, when the patient walks out with that treatment plan printout, they get to see what's going to be done in visit 1, which essentially is the next visit, visit 2, visit 3, etc. Another way that we've trained or that we've seen use the folders is sometimes based on options. Maybe the work that the patient needs to get done, they have options. They either go this way with option 1 or they go that way with option 2. So if we're offering the patient 2 options for that tooth, for example, I can create 2 folders. Label one folder option A and perhaps label the second folder option B. Again, when the patient leaves your office with that treatment plan printout, perhaps they have to think about it. Perhaps they have to think about it. It's based on financial situation. And they got to see perhaps based on your recommendation and what they're able to do. Maybe that'll be their deciding factor of which option to go to. So by separating it for the patient with option A, option B, and then walking out the door with that printout, they have that visual. They have that visual on their printout that they have 2 options. And if they pick option A, it'll be done in 3 visits. And if they pick option B, perhaps it's done in 2. That's the power of the treatment planner, is also providing that patient with that documentation that they can leave the office with if, in fact, they have to make a decision. So that's another way to use these folders. Perhaps it's because of an option the patient needs to make or choose. So that's the step I'm going to show you now, is how to actually assign visits to these cases. So what we've done so far is just separate our procedures in 2 different folders. I can come in here and rename this folder also. Remember, the system automatically creates this folder, and it simply calls it treatment plan with the date you created it on. So if you want to rename it, what you're going to do is right-click over it. Just right-click over the description of that folder, and you're going to choose Rename Case. So I've gone ahead and renamed it. And now within each folder, I'm going to assign visits. Okay? So for training purposes here, let's say that the amalgam on tooth 28 needs to be done during the next visit. Perhaps it's not going to be done today, and we've confirmed with the patient that they're going to come back next week, however the case is. So if it's not being done today and we want to treatment plan it and set it with a visit, the way you're going to do it is by right-clicking over that line and choose the option that says Move to Visit 1. So Move to Visit 1 basically means you're making it visit procedure for the first visit. Let's say that the restoration here for tooth 29 is also during visit 1. I can right-click over it and either move it to visit 1 if that's the case, or make it visit 2 instead. So let's say that one is also visit 1. And then lastly, our third option, or a third procedure I should say, let's say that one's visit 2. So now I have a folder, a treatment plan case that is called office, meaning these procedures are going to be done in-house, and I've assigned different visits. So now visually, I know what's going to be done in the next appointment, and I know what's going to be done in the second appointment. And so will the patient, because you've done that. If I had a fourth procedure in that folder, then it would allow me to either make it visit 4 or still make it visit 1, 2, or 3. I can do the same thing with the referrals if that was the case. Now, as I've been assigning visits to my cases here, take a look at your progress notes over here to the right. The system makes the change there as well. Every change you make to these folders, these cases, the system will do over here. So as you can see on my first visit, I've assigned 2 codes. My second visit, and then I have a third. I actually have another one here that you don't see because it already has a blue check mark. A blue check mark means it was already completed. It was originally in this folder, but since I've treatment planned it, I've already completed it. And that's the step I'm going to show you how to do in just a little bit. How to actually complete, like your blue check mark in the patient's chart. How to actually complete from the treatment planner. Okay? So the blue check mark is an indicator that it's already been done. Again, in terms of educating the patient, if we're discussing with the patient their treatment plan and I just want to pull up the progress notes, I can do that here at the bottom. Or perhaps I just want my case details so I can further educate the patient there on what's needed. As a reminder, if your organization maintains fee schedules or standard fees or even fee schedules in Dentrix, then perhaps you will have dollar amount information. Let me just go ahead and go back to what we had before as a view here. And again, I can do the same thing for my referral folders, but because I am referring that out, perhaps I don't need to assign any visits there. So each folder has its own case view here to the right. So if I highlight referrals, it'll have its own page, if you will. So now some other things that we can do with these folders. So we've assigned visits. Something else that we can do with these cases is update the status and set case severity. Perhaps that referral folder is immediate. The patient needs to go see that specialist. They need to be referred out. They need to get that bridge done. So if you are referring those out, I can highlight that case, come up here to my traffic light symbol, and set a severity. And your options are immediate, meaning this is urgent, that the patient gets this done. It's eventual, meaning we've treatment planned it, but perhaps it's for the future. We don't need to immediately schedule that. And then optional. So going back to the example I mentioned earlier, how perhaps you're creating different folders because the patient has maybe various options to choose from, then that would be a reasoning to perhaps use optional. So for this training, we're going to say that the referral folder, that bridge is mandatory. It's immediate. So I'm going to go ahead and just choose immediate on it. And what I'm doing is highlighting my referrals folder, the verbiage actually, not the icon. When I highlight it, click to highlight and then come up here to case severity and choose immediate. And what the system does is just puts that little red traffic symbol there as a visual cue of the severity. If I need to remove that icon, I just come back up here to set case severity, and I click none, and it goes away. I'm going to go ahead and click refresh. And take a look over here so you can see my case status itself, and it also has a severity indication. So once the patient walks out with their treatment plan, they're going to see that this case is immediate. Okay, let's go ahead and take a look at some other items here. Let me just go ahead and set some visits on these as well, just for training purposes, so you can see how a third visit will look like. So now let's talk about our update case status option. So the case status, I'm going to go ahead and click on that so you can see the different options that you will have there. And then we'll go ahead and talk about it through the workflow aspect of it. So the case status button allows us to kind of tell the system, where are we with this folder? Where are we with this case? Perhaps we've just gone as far as creating it, which is what we're doing now. We created the folder. That's as far as what we've done. We haven't presented it to the patient. So I just want to indicate it. I just want to stamp it by saying that I've created it. If I actually went as far as printing it out, I can choose printed as well. The pre-authorization are really more tied to insurances. For the most part, we don't typically maintain insurances in Dentrix. That's really off of our practice management system. So putting a pre-authorization there for primary, secondary really won't tie into any billing in Dentrix. But if you want that visual that perhaps you are waiting for an authorization from the primary insurance, I can do that. I can still select it, and for tracking purposes, the verbiage will be there. However, it won't be associated with any actual billing or referrals or authorizations. Maybe follow-up was made. Perhaps you have presented it to the patient. The patient hasn't come back to you yet on what they choose, and you've made some follow-up. Or you're following up with the insurance. That would be the follow-up made. And then there's options here as referred, proposed, accepted, and rejected. So those are really more tied to when you've actually presented it to the patient. So this referral folder right here that we know off the bat, we have referred out. I can highlight it, come up here to my case status icon, and choose referred. What the system will prompt you with now is an area for you to put any notations for this status. So perhaps here I can put any comments about this referral, and I can actually choose a referral provider's name. So if you already told the patient, go see Dr. Smith for this bridge, I can put Dr. Bridge's name there. It does pull from your provider list, so your referred to provider list, so you need to make sure to maintain and build that list. So you can put any comments there, and then you click OK. By utilizing your case statuses, the system does the system will enter and keep history of those case status histories and all the process that you've done with it. Take a look at now, because I chose that this case folder is being referred, it now also puts that little icon over that folder. So now I have two visual cues. I have the green, or I should say, I apologize, the red, the stoplight, and I have the little icon for my referred. So those two visual cues are there now. And all of that is maintained in my case status history. So let's take a look at another case status that we can use, perhaps on the other folder. So if this is being referred out, then we're probably already done. We just have to print it for the patient. As far as the Dentrix treatment planner goes, perhaps we're already done. We've created a folder, we said it was immediate, and we said we're referring it out. So perhaps that folder is done. Now the other one, we can add more to it. So let's take a look at a case status that we can associate with that folder of procedures that we're going to do in-house. So let's say that you've offered the patient, you've educated the patient, you've informed them of what their treatment plans are. Perhaps at this point you've already given them their treatment plan printouts, which we'll be talking about that in just a few. So let's say the patient has to think about it. Perhaps it's because of base of options, or perhaps because of their financial situation. We have a case option here that it says proposed. Again, one of the major things of the treatment planner, one of the robust features that the treatment planner has is that case status history. So as a provider, if you've recommended for the patient to get some work done or a certain type of procedure or options, without utilizing these case statuses, you really have no history that in fact you proposed these options to the patient or that they accepted or rejected it, but now you do. So these treatment plans have been proposed to the patient. I can come in here and say proposed. I can write a little comment here. Click OK. And now I have my little visual cue, which indicates that the patient was given these options. And now you have history. This entire trace, there's a whole trail now that we are building of case statuses for these treatment plans. So if the patient ever comes back to you and says, I wasn't given that option, or I didn't know I needed to come back, or I didn't know I needed to get that procedure done, well, we now have history, and we'll jump into that button in just a second. So the other two are accepted and rejected. So we created the case folder, we presented it to the patient, we discussed it with the patient, which is the proposed aspect of it, and at that point, the patient signs off that they're going to get the work done, perhaps today, perhaps in the future. That would mean accepted. My case folder is accepted. The moment the patient accepts that case, they're accepting it as is. I can no longer make any changes to that case folder, and we'll see that in just a second. Or maybe the patient rejected it. Maybe you offer them two options, option A, option B, and they declined option B. That would be a case status of rejected. And now you have a trace and you have a history of this information. And like I said earlier, you can complete your procedures from here as well. So if the patient actually got all 5 procedures done in their treatment plan, I can just complete that folder, and they're all completed in one shot, rather than completing each one individually. So let me briefly jump into case status history down here. So the case status history is per case. It is per folder. So the one I have highlighted right now would be my in-house procedures. So if I come down here, I get to see my case status history for that folder. And this is that trail I was mentioning to you. It was created. It was then proposed. And the most recent history will always be at the top. It says the user that created it, so it would be whoever's logged on, and any comments that may have been entered by that user. So again, if the patient comes back and questions if they ever learned of your suggestions, well, here we clearly have that history or any additional comments that we can refer back to. And again, without perhaps manually putting this in your clinical notes or just a verbal conversation, there's really no trace. There's really no proof, no trace of the status history. I did show you how to add these case statuses, the one we chose for proposed or rejected or approved. You can also do it from here. So I can come in here and manually add a case status instead of using my icons up here. Essentially, it's the same thing, but that's just another way to do that. So if I come into my case status history for my in-house procedures, and let's say I did some follow-up. I'm going to choose follow-up. I can write a note here and update. And there's my note. As you can see, there is an icon all the way to the top, right next to your view icon. There's an icon that says copy case detail to clipboard. So this right here, the top right-hand box, this is your case detail. So if you wanted to copy this into your clinical note, you could. You could do that. It will look something like this. So if you do copy that, it will look something like this, and of course I can clean it up if I wanted to. So if you wanted to include in your notes a copy and paste of that treatment plan case, I can copy it, and I'll recap on how to do that, and then you simply come into your clinical note and you paste it into your clinical note. And perhaps you can do that once you're done with your organization and your history notations. That way it does copy it exactly how it is. Again, I did that by coming up here to this icon, copy case detail to clipboard. You open up your clinical notes and paste it there. So now let's say that the patient has chosen or accepted your recommendations. So they have agreed on those in-house procedures. They have agreed that in visit 1, they're going to get work done on tooth 28 and 29, that on the second visit, they're going to get tooth 16 extracted, and then on the third visit, they're going to get some restoration done on tooth 7 and 26. So the patient has now agreed upon that case. I can come up here and now choose accepted. That means they're accepting that entire folder. So let's go ahead and do that. I'm going to go ahead and choose Update Case Status, Accepted. I'm going to write a note that the patient has agreed, or however you wish to write that comment, and click OK. So now take a look at what the system did. It kind of locked down my, as I mentioned earlier, it locked down my office folder. Why? Because the patient agreed. The moment they say they accepted to that case, they're accepting the case entirely as is, meaning that anything that you treatment plan from now on will not fall into that office case. Because we've kind of locked it down, and meaning that the patient has approved that case, what the system does now is create a third folder automatically. So anything you treatment plan from now on falls into this treatment plan folder that I have highlighted, and this one will remain as is. So if I came over here to the patient's chart and I started treatment planning something else, you're going to see how it falls into that first folder that the system just created. So again, if it's not there yet, as you can see, it's not in my treatment planner yet. Remember to use your refresh button. So the moment you hit your refresh button, there it is. So now I have a whole new folder to work with. And what we've learned up to right now, so far, we can also do with that new folder. We can rename it. We can add more treatment plans. We can give it visits if there's more than one. And we can do case status history as well. Something else you can do with these cases are associating a consent form to it. So based on our environment and based on the current workflow in many, if not all of our organizations, the consent, I should say, is in paper form, and the patient signs it off, and then it gets scanned in. And for the most part, it gets scanned in into your practice management system. For some organizations, some other organizations, perhaps they document or scan in directly into Dentrix. That's typically the workflow. And if you utilize the consent forms that come with Dentrix, or if you create your own, perhaps that same workflow will still apply. You will print it out. You will print it from Dentrix, have the patient sign it, and then it gets scanned in. But you do have the capability of generating a consent from Dentrix. So my little icon as an indicator that there is no associated to that case is the little sheet of paper with the no sign, the no symbol. So that's an indicator for you that there is no consent. To associate a consent to that patient's case, I can highlight the case, come up here to my consent form, and I can choose to add a consent form. Now, what consent form am I adding to this folder is all dependent on what you have on file. I can have a consent for anesthesia, if that was the case, treatment, perhaps the patient declined it. So I'm going to click on the drop-down for the consent form that I want, and I'm going to click on Add. And again, this is the consent that the system chooses to print, depending how you've created it. So let's take a look real quick. I'll recap those steps, but let's just take a look on how actually where these consents come from and where can you edit them and where can you create a new one. Because in order to get it from that drop-down list that I briefly just showed you, it has to come from the setup itself. And that setup is done in the settings button here at the bottom left. So here at the bottom left, we have settings. I'm just going to scroll a little bit here. And here's your setup for consent forms. So these are the ones that come with the system. If you want to edit any of the ones that are there, perhaps you want to edit the verbiage, that will be your edit button. If you don't care for any of the ones that are there and you rather create one from scratch and you want to clean up the list, then you can click delete. And then the new button obviously would be to create a new consent form. Before I actually do that, there is a drop-down menu here for the electronic signature device, and that is something that we are testing here at Health Choice Network, how to actually have a signature pad fully functional with utilizing Dentrix. That way you don't have to print those consent forms. That way the patient can just sign it directly on the screen via that signature pad. So from this point, based on today's training, we're going to go ahead and just how to add a new consent, how to edit existing ones with the purpose of printing them out for patient signature. So if I wanted to add the consent for treatment that comes with Dentrix, I will just highlight it and click edit down here. And this is the verbiage. We do work with quite a few organizations that just maintain that verbiage and just do some minor edits here and there. Perhaps their center, perhaps their organization has some specific verbiage that needs to be included. They will just add that to it as well if necessary. So it's really just a matter of typing. You know, you would just click wherever you want and type the information. It also has a spell check. There is a checkbox at the bottom that says do not include, which means the default is that it does include. So my consent will not only have this verbiage, but it will also have a list of all the procedure codes that are part of that case. So if you don't want all those procedure codes to be on the consent, then you would have to check this box. It's really all or nothing. If you do want to include the list of procedures that we have treatment plans in that case, then leave the checkbox alone. The checkbox is really the reverse of what we're probably accustomed to. So if you do not want it, then you'll check it. So the same thing applies to the consent for anesthesia. I can come in here, click edit, and make any changes to that consent if I prefer. Perhaps on that one you don't want the procedure codes listed. In that case, you would check the box. So as I mentioned, what if you wanted to create a new consent? You would click on new, you would give it a name, and enter the verbiage. Do you want to include the procedures or not? That will indicate the box at the bottom, and then you click Save. So once you create that new consent, it will be listed here in your list of consent forms that you have set up in the system. Once you have set them up through here, then when you come up over here back to where we were under treatment plan case setup, then when you try to access the consent forms, it will give you the list of options that you have there. Going back to creating the consent form, if you recall, while we were actually editing them or adding new, that we had that little checkbox if we wanted to include the procedure information on the consent form. If you do choose to include, which again means this box is unchecked, what actually prints, what information will actually print about those procedures is this button right here. So if you do want a list of all the procedures to print on the consent form, make sure to come in here and to select procedure information and check the box of what you do want to include. Perhaps you want to keep it basic. Perhaps you just want the procedure code itself and the provider and the visit and the date of entry. If you do not want to include any fees, because again, a lot of our organization maintains their fees in their practice management system. At times, Dentrix has no fees or maybe has a standard fee as a minimum. So perhaps you don't want the fees included. You can uncheck the fees box and it will not include that information on the consent that the patient signs. The centers that I've worked with, some of that verbiage has been added to the consent itself. The verbiage of that if Dentrix rather is printing a fee, a dollar amount of standard fee, but the patient falls into perhaps a scale B or a scale A, they've added that verbiage in the consent that the price perhaps will vary based on the patient's scale. Sometimes they've added that disclaimer as part of the consent. Okay, so I'm going to come back over here to our planned case, and I'm going to say that we have given this patient a consent for treatment. I'm going to add, I chose my form, and I'm going to click on Add. This is the consent itself that we just saw. And there is the list of procedures that we have the option of including or not including. And the information that we have, the information that we can choose to include or exclude as well. I can come in here and add any additional notes separate from what's in my default consent. So that is your option. If you want to add something on the fly that needs to be on that patient's consent, you would add it here. Perhaps you do want to write in their scale. They're part of scale B, and this would be their dollar amount. You have that option. So if we had a signature pad, obviously the patient would sign, and it will appear into the patient's signature box. But we have the option of clicking on print here, and it will print out the consent where the patient can sign it, and then we scan it into our practice management system. I'm going to go ahead and save and close. So now I have on file that a consent for treatment was given to the patient. Perhaps there's another consent. Maybe there's anesthesia involved. I now need to give the patient a consent for anesthesia. I can do the same steps for that as well. Or perhaps your organization has just developed a whole different consent or a different form that you just want to make sure. Perhaps it's a questionnaire that they need to fill out and you want it to be part of this step here. You can definitely be creative with this part. It doesn't necessarily have to be strictly a consent. Perhaps there's a list of 5 questions that you wanted associated to this treatment plan through this module, and you've created as a consent. I can pull it up here, print it out, have the patient fill it out, and scan it in. Okay, so I'm going to go ahead and close and take a look at my icon. My icon is now different. So I no longer have the little sheet of paper with the no symbol. It's now a paper with a pen icon here, because I now have a consent associated to that treatment plan. And if I come down here to my case history, the information the system tracks that entire process. Something else I can associate here is a treatment plan note, a case note, I should say. So I can come down here to case history, or I should say to settings. Something else you can do is a case note. So if you want to associate case notes to this patient's treatment plan case, this is where you can create a template. And again, this is separate than your clinical note. This is just remains here in the treatment planner. And that is an option also. So what you can do is you can come into template setup, create the note. You will just create the note, the verbiage itself, and you can associate it. Now, let's go ahead and take a look at, so we've gone through treatment plan case setup. We've gone through case history. Let's take a look at how to actually associate that case note. And that brings us to our supporting information button. So if I want to associate a case note to this folder, again, we saw where the template is. We saw how we created the template over here in settings. But to actually associate it to this folder, I have to go to supporting information. So what you do is, and there's a lot of other information here pertaining to financing, if you want to have that history also. Again, as far as financials go, not too much comes out of Dentrix for us. However, you could associate that history if you wanted to. I can come in here and pull up my template. Perhaps as a provider, perhaps as a hygienist, you have certain verbiage that you like to associate to these cases that are separate from your case clinical notes. So you can come in here, choose the template. You're going to click on Insert. That inserts that verbiage. You can make any edits to it if you want it to, and click and save note. As you can see, I can also add my consent from here also. I can do that from here as well. Within each folder, I have a right-click option. I can rename my cases. I can also associate my consent from here also. So there's more than one way of doing the same thing within Dentrix. So as a recap of what we've done so far, we started off by treatment planning in the patient's chart. We organized those treatment plans by creating two folders. We created two case folders. We named one office for in-house procedures, and we named the other one referrals for outside referrals. We went as far as assigning a case status for those folders, like where are we now with that case? And where we are right now as far as the history says, we've gone as far as proposing it to the patient, and the patient accepted. We also gave it a severity for the referrals folder. We gave it a severity of being immediate. Our in-house procedures, because the patient accepted, and perhaps it's being done today, we gave them a consent form, a consent for treatment. Or perhaps it's being done on a future date and we need that consent as well for the treatment plan. So we assigned a consent form to that case. Remember, you can rearrange visually your cases by using your up and down arrow. And at this point, I can print it as well. So if we want to print it out, we can either do it per case, or we can just have one report that prints everything. In this case, all 3 cases. So let's go ahead and click on the print icon here. You have print treatment case, which means it's only going to print that office case. So essentially that would be extra paper if you do one per case. What you can do is patient treatment case report. When you get that option, when you choose that option, I should say, it does give you your filter options. I can choose to do certain date ranges if I wanted to for that case. I can include financial information. So perhaps you don't want to include balances, because again, it will be different than your practice management system for the most part. So maybe you want to not include those. Perhaps you just want to include the cases that the patient approved, accepted, and not anything else. I can choose that also. If what the selections you are making is going to be your default, it's really what you prefer for every treatment plan report that you generate, you have this little box down here at the bottom left that says Save as Default. That way you're not going to find yourself selecting these filter options every time you try to do a printout for the patient. So I'm going to go ahead and just do a preview here so we can see it on the screen. And this is what it looks like. If you do one per case, it gives you the option of having a cover page if you wanted to. But again, that's just more paper consumption there. But this is a pretty clean report where it prints out all your treatment plan cases for that patient. And if this is something the patient needs to go back home and think about, all the information is here. So take a look at here at the bottom. We have the visit numbers associated to our visit. It's broken down by case folder as well. We have priorities as an indication also. We have our status that we referred. Our case notes are included. Maybe case notes are instructions for the patient at this point. I can include that too. So my case notes are there too. So quite a bit of information does print. You could choose to remove some of that information if you wanted to before you print it out. And this is what you're going to give the patient, essentially. So rather than the patient just getting a list with all the procedures, because we've done the extra steps of organizing it and categorizing them differently, that printout will have a little bit more value for the patient in terms of what is needed from them or what's the next step. Now, as I mentioned, so the patient we proposed the case to the patient and the patient has accepted it. So now we have the option of the actual day of the visit, we can complete our procedures from here. So the patient now comes in for their first visit, and they're getting tooth 28 and tooth 29 restored here. I can come in here and right-click over my first visit procedures and choose Set Complete. That means I'm completing those two procedures because they're both visit 1. Dentrix has the option of multi-select also, if you wanted to. So let's say there were 4 procedures assigned to visit 1. Instead of completing them one at a time, I can click on the first one, use my Shift key, and I can multi-select if I wanted to as well. So I'm going to right-click over the amalgam for tooth 28, and I'm going to set Complete there. So take a look at tooth 28. It's no longer in my folder. That is now a completed line item, a completed procedure. So essentially, it's the same step. It's pretty much similar if I use using this blue check mark in your patient chart. So you're either doing it from here or you're doing it from the treatment plan. It's just another area for you to be able to do that process. I can do the same thing for tooth 29. Right-click, Set Complete. And now all that's left in that case is the second and the third visit because we're already done with visit 1. The work is complete. And again, I can refresh my screen so that visuals appear at the bottom for that case. Okay. Now, what if the entire case needed to be completed? Perhaps all these codes, perhaps all these line items were being done on the same visit. Instead of sitting there and doing one by one as I just did, I can complete the entire folder if I wanted to as well. And take a look at here on the right-hand side. It puts the little blue check mark of what we've done so far in that case folder. So if I want to complete the entire folder, I'm going to highlight the folder, come up here to my case status update, and I'm going to choose completed. So the system is just giving me a warning message that it's going to complete everything I've entered or have in that folder. So I'm going to go ahead and say yes. I'm just going to write some verbiage here for training purposes. Click OK. And now that folder is gone. It's gone from my current view, but it's now in my completed view. Take a look at these 2 check boxes that we have down here. I'm only seeing what's still open, essentially. If I want to see what's completed, I just simply click on the completed case, and there's your office one. It's now completed. If I want to see the history of it, I can come down here, go to Case Status History, and I see my entire trace and trail of that folder. From the moment it was proposed to the patient, from the moment the patient accepted, and we did the work, completed. And even if the patient did the work in different visits, and you complete it line by line, let me go back to that case setup. If you come in here and complete it as I just showed you, if you come in here and complete the procedures as I just taught you one by one until it's done, it's going to leave an open folder. So you have to close that folder. It's going to leave an open folder with nothing in it, a blank folder. So even if you have completed all the procedures in that folder, you still have to complete the case itself, just to kind of close that loop and close that folder. Or else you're just going to always have an empty folder there and not have that final status. So that will always be with the completed status. This referral one, remember we did set it to referred. But let's say the patient has rejected it. I can come in here, highlight that case, choose the status rejected. It will allow me to put any notes there of why the patient is rejecting. Click OK. Again, it's gone from my view of my open cases. However, it's hiding in my rejected cases view. So I can click on rejected cases down here and see the case status history. So this is what I was mentioning to you earlier that's very powerful. In the event that you gave the patient options, 2 different cases, and they approved one and rejected the other one, but then later down the road they questioned that. Perhaps it never happened. Perhaps things weren't said. Well, you now have history. You now have that trace of why the patient rejected and when did they reject it. All that stays in history. Back in the patient's chart, if we remove treatment plans from here, there's no history there. Perhaps it's in your clinical note because you typed it, but as far as the treatment planner module goes, there wouldn't be any history there unless you follow these processes. Something else I want to go ahead and show you is in regards to just some reporting options that you will have access to in regards to the treatment planner. And remember there's 2 reporting areas in Dentrix. There's CX1 reporting, which you have to have the rights to run those, and then there's also the canned regular reports. So within the reports drop-down menu, under list, there are some treatment plans reports that you can run. Unscheduled treatment plans would be a great report to run. So if you want to make sure you don't lose track of these patients that you've treatment planned, patients that you've treatment plan procedures but aren't coming back or have not come back to your office, you can run this report, unscheduled treatment plans. You have the option of perhaps selecting a certain patient or selecting a certain date range, a certain provider, and you can choose to exclude some information. It's either going to be a detailed report or kind of like a summary condensed report. So let's take a look at what this report looks like. Once you've made your selections there. So this is what the report looks like. So it does show you, this is more the detailed version because it shows you a little bit more information about that patient's treatment plan. It shows you the phone number, so I can now go down this list and contact the patient to make sure they come back in and we schedule them for those procedures. So again, that was under reports, lists, treatment, unscheduled treatment plans, that is. Based on what we just saw in our treatment planner, I can run reports based on the approval status. So that's another example of reports that you can run to make sure the patient comes back. Perhaps the patient approved it, but we haven't completed it. I can run this report. It'll show me all treatment plans that have been approved but not complete. Another powerful report to make sure your patients are coming back and getting the work done.